Good morning. I hope you're well. Today we have a very special session. It's question and answer session about breast cancer. And we've got a long list of questions which our viewers have asked, and I'm going to go through each one of them and try to answer to my best of knowledge and understanding. So number one. So metastatic breast cancer or stage 4 breast cancer is the breast cancer which has spread to other organs of the body away from the breast. So distant organs, for example, lung, liver, bones, any parts of the body which are away from the breast. So if it is locally spread, if it is involving the muscles under the breast, it is not metastatic. If it is involving the skin above the breast, it's not metastatic. It's only metastatic when it has spread to distant organs of the body. Question number 2. There is a lot of confusion about breast cancer and metastatic breast cancer, but let me explain it to you in stages. Basically, breast cancer can be in 4 stages. You can describe it in 4 stages. Stage 1 is a cancer which is limited to the breast and it is up to 2 centimeters in size. So that is a stage 1 breast cancer. Only in one of the breasts and up to 2 centimeters in size. This is easy to treat and cure, and cure rates are very high, more than 90%, and 100% of the patients are alive beyond 5 years. So this is an early stage cancer. We would like to catch any breast cancer at this stage before it increases in size more than 2 centimeters. Now, stage 2 is a step forward. The size of the lump could be 2 to 5 centimeters with some lymph nodes in the armpits, either on this side or this side, depending on where the cancer is, but the same side as the cancer. And lymph nodes, if they're up to 3 in number, they are considered to be stage 2 and the size between 2 to 5 centimeters. If the tumor is more than 5 centimeters without lymph nodes, this is still stage 2. And this is a little bit more difficult to treat and cure, but still cure rates are high and more than 90% of the patients survive beyond 5 years. Stage 3 is a step ahead. So the tumor size could be more than 5 centimeters with 1 to 3 lymph nodes in the armpit. Or it could be lymph nodes more than 3 and any size. So it could be a 2, 3, 4 centimeter tumor, but lymph nodes are more than 3. So they could be up to 9 or 10, and we categorize them into nodal 2, nodal 3 disease, which is a little bit technical, so we don't have to go into details for that. But remember that more the number of lymph nodes, bigger the size of the tumor, higher stage it is. Also in stage 3, you could have breast tumor which is involving the skin above or the muscles below or both, or is inflamed and diffuse all over the breast with no lymph node involvement. Again, the extent of disease is ahead and more than stage 2. So that is stage 3. Survival is around 60% of the patients survive beyond 5 years. Still curable, very much treatable, but the chances of cure are less than stage 2 and stage 1. Now, stage 4 is the breast cancer, which is not limited to the breast anymore and the axillary region, the armpits. It has gone to organs beyond the breast. The difference between stage 4, which is a metastatic breast cancer, and the stage 1, 2, 3 is that stage 4 cannot be cured with the current treatment options available. It's very rare for a stage 4 disease to be curable, but it can be controlled. And survival is slightly less than stage 3. About 25% of the patients survive beyond 5 years, but with new medication and new treatment coming in, this survival is getting better and better. depends on the subtype of the tumor. Some of these tumor survival rates are higher than 25%, but overall, if you look at these tumors, stage 4, the overall survival of all the different types of breast cancer is around 25% at present. But as I said, it is improving day by day, and breast cancer is becoming like a chronic disease which can be controlled for a long period of time. Next question is very interesting. It asks, and the answer is yes, it is possible. 1% of all breast cancers happen in males. There are about 20,000 cases worldwide every year. And the reason for this is very simple. Men also have breasts. So the area of the chest where the females have breasts, men have got similar breast tissue, which is very small in size, rudimentary, not very functional. Very rarely these male breasts can become enlarged, and there are certain reasons for that happening, and I'll tell you about that. Interestingly, even babies can have developed breasts which can produce milk under the influence of the female hormone from the mother. But once those hormones are excreted out of the body and the baby is growing, those breasts, they reduce in size and they don't produce milk-like secretions anymore. Coming back to men and their breasts. So the male breasts are smaller in size compared to the female breasts because we do not have the female hormones and we've got male hormones. I mean, we have female hormones, but in a smaller quantity. We have got male hormones in a higher quantity. Even females have male hormones in small quantity and female hormones in higher quantity, the other way around. And that is the reason why they look and develop differently from men. Now, if there is any imbalance of these hormones, so the female hormones become more in a male, the breasts become bigger. This condition is known as gynecomastia. Sometimes they might even produce secretions, milk-like secretions called galactorrhea. Now, what are the conditions which are going to increase the size of male breasts? So any condition which is going to increase the level of female hormones in a male's body. For example, liver cirrhosis, damage to liver, because liver breaks down hormones and reduces their levels. Certain drugs which inhibit liver enzymes. Then there is chronic kidney disease. There is diabetes and obesity. And there are certain type of tumors, like testicular tumors can sometimes start producing female hormones. Similarly, pituitary tumors, pituitary is a small gland found in the brain. Tumors of pituitary can do that, and also rarely lung cancers can produce kind of chemicals which would cause gynecomastia, enlargement of the male breast. But male breast cancer is a slightly different story. There was usually this thought that if men have gynecomastia, if their breasts are becoming bigger, they are at more risk of breast cancer. But the jury's still out on it. Some studies show there's a positive correlation. Having gynecomastia increases the risk of breast cancer. Other studies say no, there isn't. What we do know is that exposure to radiation at a young age can cause male breasts to develop cancers just like female breasts. So Hiroshima and Nagasaki survivors after the atomic bomb explosion in Japan, incidences of breast cancer were higher among both males and females relatively. And then there are certain genetic disorders which are associated with multiple kinds of cancer, the BRCA1 and BRCA2 gene mutations which run in the families, the Lynch syndrome, Li-Fraumeni syndrome, Cowden syndrome, many familial genetic problems which increase the risk of all cancer, including breast cancer in males. Important thing about male breast cancer, again, if you have the risk factors, radiation exposure, or if you have family history of any inherited disorders, or if you feel any lumps or bump, must get it checked and treated early. Because male breasts are smaller than female breasts, chances of cancer spreading to the muscle below or skin above and getting more advanced is bigger. So in the female, the stages would be a bit slow, but because males have small breasts, the stages will progress very quickly. Treatment is similar to female breast cancer, and as effective as it is with the female breast cancer. Cure rates are higher at early stages, less at later stages. So very important: screening and prevention. Lack of exercise and increased alcohol intake increase the risk of breast cancer in males. Another condition which increases chances of breast cancer in men is a syndrome known as the Klinefelter syndrome. This is a condition in which babies are born with extra X chromosome in every cell of their body. Normally a man would have one X chromosome and one Y chromosome, but some babies are born with two X and one Y chromosome. This condition is associated with small testes and small penis size, so hypogonadism, and a slow growth of genital organs. They tend to be very tall, and they also have an increased risk of breast cancer later in life. Not everyone with Klinefelter syndrome would have breast cancer, but the risk is higher compared to the general population. The next question is one of the most complex questions about breast cancer. Even doctors and medical students especially struggle with it. And it's very brave of the person who asked this question. I'll try to simplify it. Okay, listen to the question. What do the following mean? Estrogen receptor positive, hormone receptor positive, luminal A, luminal B, HER2 positive, basal-like, triple negative breast cancer. So very technical terms about the types of breast cancer. We're going to simplify it, and by the end of this discussion you're going to be expert on types of breast cancer. Okay, breast cancer, they arise from breast. Breast has got different structures. Of course it makes milk, so it have milk glands. So the breast cancer can arise from the cells in the milk gland, in which case it's known as lobular, which is quite rare for milk gland cell lining to become cancerous. But most of the breast cancers, they arise from the ducts, the small tubules which carry milk to the nipple, and they are known as ductal or luminal breast cancers because they come from the lumen, the lining of the ducts from which the milk is carried. That's one way of describing these breast cancers, depending on their organ, on the site of origin. Of course the organ is breast, but the site of origin. Then there are some blood vessels in the breast, so you can really get angiosarcomas. There are lymph nodes, and you've got lymphatic tissue in the breast, so you can really get lymphomas. And there are other rare types of breast cancer arising from other tissues in the breast, but the most common are the ductal, luminal, and somewhat the lobular from the ducts of the breast. The second way to classify breast cancer is what growth factors do they need to grow. Most of them feed on hormones, and there are two types of female hormones. They feed on estrogen and progesterone. So if they have any of these hormones, we call them hormone receptor positive. If they've got estrogen receptors on them, we call them estrogen receptor positive, ER positive, which means they use estrogen to feed them and to grow them. If they have progesterone receptors on them, we call them PR positive, which means that they can use progesterone as a growth factor. And then there is a third kind of growth factor, which is known as HER2, HER2. Might have heard of it. A lot of drugs are made targeting this one, and new drugs come all the time, so it's in the news every now and then. And if they're positive for that, we call them HER2 positive. Over the years, there's been an effort to combine the two classifications. The combination classification has resulted in luminal A, luminal B, and basal type or triple negative. Let's look at them. What a luminal A, luminal B, and basal type or triple negative is. 40% of the breast cancers are called luminal A. They arise from the cells inside the lumen of the ducts which carry the breast milk. So that's why we call them luminal. And they call luminal A because they have estrogen receptor positive, and they are usually the best responsive to treatment, and the prognosis is really good. The second type, which is about 20% of the breast cancers, This is known as luminal B. Now, luminal B cancers are also born from the lining, the lumen lining, the inner lining of the ducts which carry breast milk. But they can be also HER2 positive. They have estrogen receptor positivity, hormone positive, but they could also have that additional growth factor known as the HER2 growth factor. They tend to be bigger in size, they tend to spread to the lymph nodes more often, and are a bit more difficult to treat compared to the luminal A type, which does not have HER2 involvement in it. Now, luminal A and luminal B, remember, are coming from the lumen, the inside of the lining of the ducts which carry breast milk. The outside of these ducts have cells known as basal cells, and the tumors which are born in these cells, mutation of the basal cells, are known as the basal type, and these are also known as triple negative because they do not have hormone receptors, they don't have ER or PR receptors, they do not have the HER2 receptors. So they feed on different growth factors which can be of varieties which we know and some that we do not know of, so they're difficult to target. For the estrogen and progesterone positive breast cancer, you can block these hormones and slow the growth and even kill the cells. HER2 positive, you can kill the cells by blocking HER2 receptors. But these triple negative, they don't have these receptors which you normally target, so they're a bit difficult to treat. They tend to be quite aggressive. So this is the type we have talked about based on the luminal and basal type. There is another type of breast cancer which is known as HER2 enriched. These are breast cancers which could arise from the ducts inside or outside, but they are very rich in this growth factor receptor known as HER2, and they feed on HER2. I call them the cobra of breast cancer. They're very vicious, they spread to lymph nodes very quickly, they also have a tendency to spread to the brain. They used to have a very bad prognosis, but nowadays they're treated very well. The reason, just like the cobra, they've got this HER2 receptor which can be detected very easily, and once you see this HER2 receptor, like that big hood of the cobra, you know how to target it, and you know it's the bad boy. You're gonna hit it with specific drugs. So there are many specific HER2 blocking drugs which could be used with less side effects, and they could be used for a very long period of time, and the cure of these cancers is becoming much better, especially if found at an early stage. And even if they're found at a later stage, like stage 4 metastatic, you can treat it and control it very well. Now, a rarer type of cancer, among many others like angiosarcomas, mucinoid, lymphomas, there is a type known as the lobular breast cancer. This lobular breast cancer is especially of interest because it tends to spread far and wide and is caught very late. I compare it to that snake, the common crate, which bites people, but people just think they had a insect bite or a mosquito bite, and by the time they realize they've been bitten by a snake, the poison has spread far and wide. Lobular, remember, invasive lobular carcinoma is coming from the lobules, the glands which are making milk, and the inner lining of those glands. It's rare, but it tends to spread silently and far away. Even when you have a small lump in the breast, it might have spread to other organs. So this is the one to watch for and to target. Fortunately, it is very less common compared to the other types, and we don't come across it a lot. It tends to respond to chemotherapy like the other cancers, but is not as good to treat and not as easy to cure as the others because it is spreading very far and wide before you often detect it. This is a general overview of the advanced types of breast cancer. So just remember, it depends on where the breast cancer cell was born: inside the lumen, luminal, outside the duct, basal, or from the lobules of the cell which are making milk in the gland, lobular kind of cancer. And then you have the type of receptors they have, whether they have hormone feeding receptors or HER2 feeding receptors, or they don't have any one of them, in which case we call them triple negative. Okay guys, brace yourself, ladies and gentlemen. Next question is a very loaded question. Women of color have less of a chance of having breast cancer. True. but are more likely to die from it. Is this true? Unfortunately and sadly, yes. But let us first define what are women of color. So in America, women of color are the African Americans, the Hispanics, the Asians, and Native Americans. And all of these groups tend to have a lower risk of having breast cancer compared to the white Caucasian women. But their chance of dying from breast cancer is higher, which is ironic that they have less chances of getting cancer, but once they get cancer, their chances of dying are higher than the women of white Caucasian race. Same is true in UK, where the women of color are called the BAME, B-A-M-E, that is Black, Asian, minority ethnic group, and they have a less chance of having breast cancer but a higher chance of dying from it. There have been many studies about it over the years, more than a decade of studies, and I've gone through most of them, and some of them blame the socioeconomic group. They say the colored women coming from lower socioeconomic group. There are health inequalities. There are inequalities in access to health facilities. There are inequalities the way they are receiving treatment. So there's a bit of a bias there. Many factors have been described, but I think the basic difference between the two groups is what stage they find the cancer. We already talked about the stages of stage 1, 2, 3, 4, and we realize that stage 1 you've got 100% chance of being alive after 5 years. Stage 2 it drops to about 90%, stage 3 to around 60%, stage 4 metastatic breast cancer around 25%. So if you are finding any breast cancer at a later stage, your survival rates are low. And as a general rule, women of color, whether they are in the United States of America or they are in England, United Kingdom, or a European Union country, we tend to see that they get diagnosed late. And that is the main factor. There might be many other factors which play a small but important role, but the most important factor which plays a main role in their survival is being diagnosed late. There's less trend of them getting into screening programs, follow up with screening. There's a lot of taboo around cancer. They don't like to talk about it, and I've often seen this attitude in which patients are saying, I was afraid to go to the doctor because the doctor might find a major health problem with me. And this is quite a counterproductive argument, because if you are delaying the diagnosis of an underlying health problem, you are making it more difficult to treat and potentially life-threatening, especially when it comes to cancer. So you have to be proactive about it. The Caucasian women, because they belong mostly to a better socioeconomic group, they tend to be more proactive, whereas the non-Caucasian women, we call them women of color, they tend to be less proactive in seeking screening programs and health advice and health facilities. So main thing again is screening. Remember, if you can catch breast cancer at an early stage, chances of curing it is more than 90%. Stage 1 survival 100% at 5 years and beyond even. So very important that we do the screening, we catch it early, and we are on the ball. We are very active in preventing cancer, and that is the mission of Killing Cancer Kind. We want to prevent, detect, treat and cure cancer, and that is our message to everyone, that despite what your taboos might be, social taboos about cancer, it is a reality. You have to confront it, you have to fight it, and the sooner you get hold of it, the better it is, because you can get rid of it for good and you can cure it completely. Next question. Is the breast cancer found in younger girls more aggressive and difficult to treat than the one in menopausal women? Yes, it is. Usually most of the breast cancers occur above the age of 60. and that is the reason why the screening programs are started around the age of 50, because it takes almost 10 years for the cancer to grow and become incurable, so we try to catch it early. However, recently there has been a trend of breast cancer occurring in younger women, and we are seeing more aggressive breast cancer. So almost 7% of the breast cancers are occurring in women below the age of 40, and about 1% are occurring in women below the age of 30. But the trend is on the rise, and Killing Cancer Kindly is especially focused on identifying what are the factors which are making cancer occur earlier and earlier in younger people, not just breast cancer but even other cancers. And we've identified many risk factors which we talk about, and you have the videos on it. One of the risk factors for younger women having breast cancer is exposure to radiation. So if they've had radiation to the chest as part of their treatment or diagnostic procedures at a very young age, they are at a higher risk of developing breast cancer in a young age. Secondly, early menarche. If they are becoming adolescent very early, and if they are having their first menstrual period at a very early age, chances of them developing breast cancer at an earlier age are higher, because you've got a longer period of time when the body, especially the breasts, are exposed to female hormones. Having less children and not breastfeeding also increases the risk, as do many familial breast cancers. So if there's a strong family history, or if there's a known genetic mutation which runs in the family, like BRCA1, BRCA2, BRCA1, BRCA2, or Lee-Fraumeni syndrome or Cowden syndrome, there are many different syndromes which affect certain families, and they tend to have a higher risk of breast cancer. My advice to most patients is that if anyone in your family, an immediate relative or a close relative, has had breast cancer at a younger age, you should start screening 10 years before that. So if a mom or a sister or an aunt has had breast cancer at age of, let's say, 50, you start your screening at 40. If they've had it at 40, you start your screening at 30. And remember, screening for young women, mammography does not work very well. The low dose X-ray mammogram doesn't work very well. You have to get MRI, magnetic resonance imaging of the breast. That is the best way for screening. But contact your doctor, seek advice from local experts, and follow the local guidelines. If you are having any difficulty, we have got advice and guidelines on our YouTube channel, Killing Cancer Kindly, and you can seek advice there. And yes, the younger breast cancers tend to be more aggressive. Now, why is that? Firstly, because they are aggressive, they're occurring at a young age. Screening programs are not there, they're found at a later stage. And I believe in younger people, the risks are higher to produce the breast cancer. So there are usually multiple risk factors there which cause the breast cancer in a younger person, or their genetic mutations which are running in the family, and their repair problems to the DNA. So because the risk factors are higher, multiple, more intense, that is why these cancers also tend to be more aggressive. However, if you catch them early, you can still cure them, and the chances of cure are very high if you are catching it at a very early stage. The next question is even more technical. This asks, what is neoadjuvant therapy? What is adjuvant therapy? What is the difference, and why do we need it? Technical question, but very simple to understand. I know the terms are very confusing. Neoadjuvant, adjuvant. Adjuvant actually means something which helps. So it's helpful treatment. It's an additional treatment which makes the main treatment more effective. So that's the basic idea. Now, to understand treatment, radical treatment, curative treatment of breast cancer, which is for stage 1, 2, and 3, when you can get rid of breast cancer for good, you have to understand that we are attacking the cancer as you would attack an enemy in war. So when you are starting a full-fledged war, first you have initial attacks in which you try to cut the animal supply lines, you try to reduce the number of forces you're going to fight. that is neoadjuvant treatment. Any pockets of resistance, any residual disease, microscopic disease, cancer cells which might be hiding here and there. So neoadjuvant, we use chemotherapy and hormone therapy. We do not use radiotherapy because we don't want to damage the breast. After that, if you do surgery, it won't heal properly, so we leave the radiotherapy for later on. Then we do the major surgery, which is the radical treatment, and after that we give chemotherapy and we can give radiotherapy, radiate the area. And later on you can even use hormone therapy, which can go on for many years and reduces the risk of any surviving cancer cells to grow and make a new cancer. So that's in a nutshell your neoadjuvant, radical and adjuvant treatment, and what the difference is. Just remember, neoadjuvant is before the main attack, then you have the main attack, the surgery, and adjuvant is after the main attack, and this increases the chances of cure. And that is the reason why with this strategy of pre-war, war and post-war attacks, we are getting very good results. We are getting cancer cure rates up to 90% and above, especially in the early stage of disease. Next question. Very interesting. Do breast cancer survivors or patients gain weight after 2 to 3 years of diagnosis? Yes, some do. In all honesty, everyone gains weight generally as the years go by, and cancer patients and breast cancer patients are no different. So you see this tendency of patients coming in which are slim and smart or not very much on the heavy side. After treatment, a few years later on follow-up, you do see that they are gaining weight. In all honesty, if you look at yourself, the doctors are also gaining weight. But yes, the trend seems to be more in the patients on treatment. One of the reasons is hormone therapy. Hormone therapy tends to put on more weight on the patient. Been many studies about it, and most of the patients have reported weight gain after starting hormone therapy. There is also an issue of diet. Some of the patients, their diet changes after breast cancer, and that has an effect on their weight gain. And as I said, activity levels and general lifestyle changes, they also have an impact. Some patients who are on treatment, they're not physically that active, they would tend to gain more weight. Others might become more sedentary as the years go by, or due to the effects of treatment, they do not feel the same levels of energy and they might end up with more weight. But this is not a hard and fast rule. Not every patient who's had treatment for cancer or who's had cancer would gain weight later on, and if they do, it might be due to the general physiological lifestyle reasons which make everyone put on weight, patients and doctors alike. Okay, next is a series of questions which are quite challenging and very interesting. So let's go through them one by one. First is, what are the different types of breast tumors? What's the difference between a benign and malignant breast tumor? And which type of breast tumor is the most dangerous? I presume means most difficult to treat and cure. Okay, let's start. Let me draw a parallel here. The parallel would be, we are all familiar with the reptiles known as snakes. There are many types of snakes. 90% of them are non-poisonous, 10% are poisonous. So the non-poisonous snake, if it bites a person, it won't kill him, but it's quite scary because you're bitten by a snake, and you usually can't tell a difference between a poisonous and a non-poisonous snake unless and until you're an expert in the field or you've dealt with snakes. So when talking about snakes, there are some which are evidently very dangerous, very poisonous, like the cobras, and they're easy to spot because they have this big hood and you can see them far away and you know this is a deadly venomous snake. But the most dangerous snake is the one which bites you and you don't feel the pain. It feels like a mosquito bite or an insect bite, and the poison spreads in the body and it's detected very late. This is a common trait found in South Asia, Pakistan, Bangladesh, India. Now this snake, it can bite people when they're sleeping and people will think they've just been bitten by a mosquito. It's not very painful. And by the time they wake up or they realize that they've been bitten by a snake, the poison has spread in the body. Now, Same rule applies to breast cancer. The most aggressive and difficult to treat breast cancer is the one which is found late, when it is spread in the body and starts like a small lump which is difficult to detect, or which goes missing on the general examination, and you only find it at a much later stage. So staging and spread of the cancer is what determines how nasty it is and how difficult it would be to treat. Coming back to our example of poisonous and non-poisonous snakes, that 90% of the snakes are non-poisonous and 10% are poisonous. So breast tumors or lumps found in the breast, 90% of them are not cancers. Only a small proportion are malignant cancerous tumors which have the ability to spread. A benign breast tumor is the one which is just a lump in the breast which is growing but not spreading anywhere. Whereas a cancer or a malignant breast tumor is a lump which has got cells which are able to break out of that structure and spread locally, and also spread to lymph nodes and go through the bloodstream and spread to other parts of the body. These are the cancers. The difference between benign and malignant is the ability of the disease to spread, destroy locally, and spread to distant areas and become life-threatening. Again, you are as much scared of a benign lump as you are of a malignant lump when you feel it in the breast. Screening can be very scary, but we have to reassure everyone, and I would like to reassure the people listening to this video, that most of the time when a lump or a bump is found in the breast, it turns out to be an innocuous benign tumor or just a swelling, a fibroma or fibroadenoma, which doesn't need even treatment most of the time, or it can be removed and it does not show any dangerous features, so you don't have to have any intensive treatment after that. But 1 out of 10% of these lumps could be cancerous, so it's not worth taking the risk to ignore a lump in the breast. So always have it investigated and always have it checked by a professional, and if it is a malignant disease, early stage, 100% cure is possible. More than 90% cure is quite achievable, and this is what we should aim. We've got a very good video on Killing Cancer Kindly which explains what exactly is cancer, why cancer cells are born, how they can be prevented, and how the body treats them, and how the body tries to get rid of them. And remember, there are almost 1,000 cancer cells born in every normal human being every day. And the body has the systems to kill all of it. It's only when the number of cancer cells born in the body exceeds the capacity and the limit of the body to kill them or to repair them, that is when cancer becomes a problem. Otherwise, our body is very good at killing cancer cells. It kills more than 1,000 every day. And there are ways to enhance this ability of the body to fight, kill, treat, prevent, and cure cancer. And Killing Cancer Kindly is committed to identifying, searching, researching, and studying these methods and these ways and sharing it with you. So subscribe to Killing Cancer Kindly, press the bell icon so you can get regular updates on health promotion, disease prevention, staying younger, living longer by killing cancer and killing it kindly. And please share it with everyone, because together we will save more lives. Thank you very much for your time.